All right. You ready?
Let's do it.
Okay. Um, so thanks for taking a few minutes here to be with me today, Robbie. I appreciate it.
Absolutely.
Um, I'm not going to really go into, who you are, what you do. I mean, if people really want to find out, they can just certainly go to the website and find out more about you. I just want to get to the nuts and bolts of this and really just dive deep into sort of this concept of carbohydrates and diabetes. You know, for me, sort of where I want to go with this is the first part. What really interests me is, I think if you dive into the research, you can, find a lot of research for, why we need to be eating plant-based. You can also find a lot of research for potentially why ketogenic or paleo diet could be a benefit. But what is really, really crazy when you really look at what the two of you have done is both of you are suffering from type 1 diabetes. And if you look behind you, there is just a ton of fruit there. And so I know that both of you are just fruitaholics, yet you're
Yes, sir.
you're thriving and surviving. And so the first question I have for you is, why should we not be scared of carbohydrates when it comes to diabetes?
Okay, so I'm so glad you brought up the topic of the amount of confusing research. And the truth is, when you actually take the time to look at the research and read what is said in these various studies, the conclusion is very simple, it's very clear, and it's not confusing. So people living with diabetes, no matter what form of diabetes you're living with, the number one goal that we want people to do is to maximize their insulin sensitivity, okay? Your goal is to make the insulin that either your body produces or you inject work as efficiently as possible. And that's why the subtitle of our book is The Revolutionary Method to Reverse Insulin Resistance Permanently in Type 1, Type 1.5, Type 2, Prediabetes, and Gestational Diabetes. That's what we're doing here. We're reversing insulin resistance. So what is that? In short, insulin resistance is when your body is struggling to take glucose out of your bloodstream and into your cells. Okay, that is a state of insulin resistance. Then you have excess glucose in your bloodstream, and you also have high insulin levels because your body is trying to compensate for this issue. So your body says, okay, no, I'll just produce more and more insulin and try and shove it in there. So you have high glucose, high insulin levels. You cannot be living with prediabetes or type 2 diabetes and not be insulin resistant. That is the cause of those conditions. And about 90% of people living with all forms of diabetes are living with prediabetes or type 2. Now, people living with insulin-dependent diabetes like Cyrus and myself, you could be insulin sensitive or insulin resistant. Unfortunately, most people living with insulin-dependent diabetes are insulin resistant. So with type 1 diabetes, it's very easy for us to assess this on a meal-by-meal basis. We know how much insulin we inject. We know how much carbohydrate we consume per meal, and we're constantly testing our blood glucose values. With that piece of information, you can figure out, are you insulin sensitive or are you not? And so Cyrus and I had this personal experience of getting to transition to this low-fat, plant-based whole food diet where we learned we could eat unlimited amounts. We were literally taught, Robby, Cyrus, you guys can eat as many whole carbohydrate foods as you want, as long as your diet is low in fat, and you will see an improvement in your diabetes health. And we were both like pretty skeptical. But when you experience it every single meal, every day, we're like, wait a minute. I just reduced my insulin use and ate 5 times more carbohydrate than I was eating before. Like what's going on here? And so you have that personal experience, which corroborates what we're seeing in the science. So this idea that when you eat a low-fat, plant-based whole food diet, improving your insulin sensitivity literally dates back to when insulin was discovered. Insulin was discovered in 1921, first used in humans in 1922, and there's research from one of the first physicians using insulin, Dr. Sansom, in 1926, showing that when he reduced the fat intake and included more carbohydrate food, he included potatoes, he included bread, and he included fruit. He saw that his patients' insulin sensitivity increased. That's in the very beginning. And then there is research after research, decade after decade, in demonstrating this. So what's happening here is that the reason insulin's not working efficiently is because there's excess fat stored inside cells that are not designed to store fat, okay? That's the cause of insulin resistance. And so when you remove excess dietary fat from the foods you're eating, when you take these high fat foods out of your diet, that extra fat deposit in cells that are not designed to store fat begins to dissipate. And as that happens, you now become more insulin sensitive. Your cells are ready to uptake glucose. And this is, again, a process that if anybody's listening, they're like, I just don't believe it. I don't believe this guy that I can eat a bunch of bananas and mangoes and potatoes and rice and beans and see my blood glucose come down. Like, I don't believe that. The fun part is all you have to do is give it a shot. Right. You just try it and you will see the results in days. I kid you not, you will see the results in days. People living with type 2 diabetes, they will see that fasting blood glucose number come down. Even if they're super, super insulin resistant, if they're doing it properly and they're adding in lots of greens and they're moving their body, days to weeks, maybe a little bit longer if you're super, super insulin resistant, but the vast majority of people, we're talking, people with pre-diabetes. In America alone, we have over 85 million people living with pre-diabetes and they don't even know it.
Right.
And they will absolutely see results in days because they're producing plenty of insulin. They're in the very early stages of diabetes developing. And when you have plenty of insulin, your body's gonna make this adjustment very, very quickly. So the bottom line is we know through research of long-lived people that those societies that eat a lower fat diet, lots of carbohydrate-rich foods, have low rates of diabetes. That's a Seventh-day Adventist in Loma Linda. You have many of the other blue zones where you're talking about people living in the Nicoya Peninsula, Costa Rica, Okinawa, Japan. So Dan Buettner has identified blue zones around the world. We can look at those people. But then we can look at a large amount of peer-reviewed research, again, over the years, of people actually reversing their diabetes by following a low-fat diet. So, I mean, it's really endless. Dr. Walter Kempner was doing it in the 1950s, and his diet wasn't even a healthy diet that we'd recommend. It was just happened to be low in fat. That's the kicker. So we can easily demonstrate how to maximize your insulin sensitivity. But we take it a step further and say, look, we're not just going to maximize your insulin sensitivity, we're going to maximize your nutrient density and your long-term health and your ability to reduce your risk of other chronic diseases which come along with diabetes. And so I want to talk more about that. I want to talk about heart disease real quick, but I want to address the confusion around ketogenic diets. And you're seeing that research, you're seeing those books, those authors. Here's the distinction that I really want people to understand. When you follow a ketogenic diet, you are not maximizing your insulin sensitivity, okay? You are simply removing carbohydrates from your diet. Removing carbohydrates from your diet or limiting them to a very, very low amount is not the same as becoming insulin sensitive. So yes, if you stop eating carbohydrates, you can lower your insulin levels. Okay, you don't need as much insulin when you're not eating carbohydrate-rich food anymore. You can lose weight. You can get off diabetes medications. You can lower your A1C. All these great things happen. But what you're not doing is you're not maximizing insulin sensitivity. And we know this because if anybody following a ketogenic diet starts to eat a banana, a potato, some berries, they see a blood glucose spike. And they say, okay, wait a minute, look, the fruit causes insulin spikes, causes my blood glucose to spike. That's the problem. That's why I got diabetes. I'm just gonna not eat those. But that is a complete misunderstanding of biology. The reason that their body's not able to metabolize the fruit or the potato is because they have excess fat stored in muscle and liver cells. They've eaten themselves into a state of insulin resistance. And so they're not actually addressing the root cause of prediabetes and type 2 diabetes. They're simply removing the carbohydrates. So imagine you're a bad driver and you get in car accidents all the time, and you get speeding tickets all the time. If I take away your driver's license, you don't get any more accidents and you don't get speeding tickets anymore. But I did not address the problem. I didn't teach you how to become a better driver. People following a ketogenic diet are not maximizing their metabolic health so they can metabolize healthy, whole, carbohydrate-rich foods. That's what's happening here. So that's the distinction. And again, I respect the ketogenic community. I like the ketogenic community. Any human being who's willing to take full control of their health and to stop eating junk food and be really conscious about everything they're putting in their body, like, congratulations. People who are losing hundreds of pounds, getting off medications, and feeling better on a ketogenic diet, like, congratulations. Like, pat yourself on the back. You're putting in a lot of effort. That's fantastic. I'm happy for you. But we're just here not to tell you what you're doing is wrong and you should stop and you should change and you're bad. That's not what we're here to do. We're here to raise awareness about a conversation of what is insulin sensitivity and what does it mean to be insulin sensitive. So we're sharing this message that all those amazing results they achieved on the ketogenic diet, they could have also achieved on a low-fat, plant-based whole food diet while also being insulin sensitive. Right. And we see this in the literature. The study that actually shows the greatest amount of weight loss at a 6-month period was the BROAD study, randomized controlled trial, low-fat, plant-based whole food diet, where the participants were not mandated to calorie restrict and they were not mandated to do any exercise. It was simply an adjustment of their diet, and they saw the greatest weight loss of any study ever published at 6 months. It was over 26 pounds. So they maintained it from the beginning of when they were taught what to do. So the point is yes, you can lose weight. Yes, you can lower your A1C. Yes, you can get off diabetes medications. You can lower your cholesterol, lower your sugar. All this stuff can happen while eating carbohydrate-rich food as long as you're doing it in a low-fat environment. So that was a long-winded answer. I hope it was helpful. We can talk more about heart disease if you want to, but the point is to become insulin sensitive, you have to be following a low-fat diet.
Yeah. No, that was great. I think you covered pretty much all my questions on that. I was going to talk about why we should focus on carbohydrates, but you really explained that. So I'm kind of interested. How long did it take you when you switched over to to only carbohydrates, where you became like where your sensitivity started to become more optimal? Like, what was sort of like a time frame?
Okay, so my personal change was overnight. I made a rapid change. We don't necessarily recommend that. We see that a lot of our clients experience a more graceful transition when they just change one meal at a time and take that slowly at their own pace. And when you do that, you get really smooth, consistent results. But for me personally, I changed overnight. And because I'm living with type 1 diabetes and I'm injecting insulin, I saw the changes within 24 hours. And then it got even a bigger change in 48 hours, and then a bigger change in 72 hours. And we see this repeatedly in all of our insulin-dependent clients, especially those using fast-acting insulin. You will see your insulin sensitivity improve dramatically. And over the course of about 3 months or so, we'll see people have a 10 to 60% reduction in total insulin use while simultaneously increasing their carbohydrate content. And I want to make it clear, it's like, we're not talking about a diet that's just carbohydrates. This is whole foods, which naturally contain healthy amounts of essential fatty acids and also healthy amounts of essential proteins. So when you follow this whole food diet, you end up landing with what you need. But the point is, it's predominantly carbohydrate-rich foods, or the macronutrient ratio that's predominant is carbohydrates. We're recommending a minimum of 70% of calories coming from whole carbohydrates and a maximum of 15% coming from fat and protein. So for me, you'll see many people living with type 1 diabetes. Their mealtime ratio, they'll inject maybe 1 unit for every 5 grams of carbohydrate, or maybe 10 if they're a little more insulin sensitive.
Right.
For me, at a meal, I'm injecting somewhere between 30 to 1, 50 to 1, 80 to 1, like this dramatic difference in insulin sensitivity. And other people achieve this just as consistently as Cyrus and I have when adopting our program.
And how long have you, like, how long ago was that? How many years ago was it that you switched, and where you've been able
13 years ago, over 13
years
years. I started this diet December of 2006.
Right. So this is not something that, you know, is in a year's time is going to be different. I mean, this is a long-term approach with.
Oh, that's exactly right. We're adamant about people making lifestyle change that will last for a lifetime.
Yeah. And then, I mean, the last question I have, but you answered that too, is really this issue of fat in the cell. So you guys are sort of really convinced that the high consumption of fat really just clogs up the cellular structure, and as a result, you know, develops this sensitivity issue.
So that's exactly right. And this has been demonstrated in a wide array of research. In 1971, Dr. Brunzell published a paper in The Lancet. And this is a paper where he fed people a liquid sugar diet. We're talking a diet of dextrose and protein powder. Not something we would recommend, but he did this to try and understand how would a zero fat diet impact somebody's insulin sensitivity. What would happen to their blood glucose levels, to their insulin levels, when he actually fed them zero fat. Again, a zero fat diet is not actually even possible when you're eating whole foods, because you're going to get fat in the whole foods that you consume.
Right.
So in this study, he fed them, he had a control group. So the control group, they ate a standard diet, and their percentage of calories from fat was about 40%. All right. So they actually, it wasn't a control group. He fed the same subjects each of these 2 different diets. And then he compared what would happen on a paired oral glucose tolerance test. What happens when I give these subjects, I think it was 75 grams of carbohydrate, and then he tested their insulin levels and their blood glucose levels at every 30 minutes. And you would expect that if somebody is fed a sugar water diet with zero fat, that they would have a higher insulin level and higher blood glucose level at every point throughout an oral glucose tolerance test. That's what you would expect.
Yeah.
But he found the opposite. At every single point, blood glucose was lower and insulin levels were lower. This is demonstrating clearly that insulin sensitivity improved on a processed low-fat diet. And then we also have studies from, one of our favorite studies is the Kylene Ward, and I'm blanking on the other guy's name. Anyways, this is a study where he had 20 lean type 2 diabetics. And after just 16 days of feeding them a low-fat, plant-based, whole food diet, half of them stopped using insulin. Everybody was on insulin in the beginning. And after 16 days, he has half of them using zero insulin with the same blood glucose control they had previously. Right. And this is feeding them. This is actually, it was James W. Anderson. That was the paper. And it was in the American Journal of Clinical Nutrition, 1979. It was just fascinating. So, I mean, I could tell you study after study after study. Yeah. And so we know, based on research in human beings, that when they are fed a truly low-fat diet, and again, maximum 15% of calories coming from fat, you will consistently see an improvement in insulin sensitivity, in weight loss, in A1C values. It's just consistent across the board.
Yeah, that's great. You know, again, thank you for taking the time. you know what, one of the things that that I did this last little while is I bought myself a continuous glucose monitor.
Mm.
And I don't suffer type 2, type 1, or type 1.5, but I was quite shocked at my morning glucose. It was running in the neighborhood of above 110, 120, 125, 130 consistently in the morning. And I was, you know, for the most part, yeah, I would say vegetarian. I was consuming cheese because in Holland we have cheese, and I wasn't really paying much attention to that and was eating that. As soon as I took out the cheese and went to a completely whole food plant-based diet, it was within a week I was down under the 90s for fasting glucose. It was, I mean, it was just like night and day. It was incredible. So even just from not being diagnosed with insulin sensitivity or diabetes, when you look at those aspects, it's amazing how your body changes just when you respect yeah, its needs and its proper operating procedure. So it's great.
I'm super happy to hear that, and I'm glad you're using a continuous glucose monitor. It provides a lot of great data. I assume you're using a Freestyle Libre?
Yeah, yeah. I couldn't penny up for the Dexcom,
For sure.
which was the other one. But I mean, the Libre works well, and you know, as long as you're consistently using it, you can really get some interesting things. And I think for the future, it's a very cheap and inexpensive and great way to monitor how your health is doing, just from that aspect. So
I couldn't agree more. Yeah, CGM is great technology, and I hope more and more people begin to use it.
yeah. So yeah, I want to thank you. I know you're busy and you've got lots of stuff to do today, so I appreciate your time. And yeah, for those that are interested, down below underneath the post, you'll see a link to the Mastering Diabetes program. Or if you're like me and just curious and want to buy the book, I definitely recommend the book. I've read it from front to back, back to front, and it's great information, even just for those wanting to improve their health. So thank you for your time, and give my best to Cyrus. And yeah. I'm
Certainly
glad you
will.
guys are here doing this stuff.
Thank you so much. I appreciate you sharing this information, and the work that you're doing to get it out to your clients means a lot. So thank you.
You're welcome.